Week 4 of 606. I hope you guys all had a good week. We are starting into our 4th module of the semester, so way to go. Today's also the first Vikings game. I assume since you are all attending grad school in Minnesota that you will all be cheering for the Minnesota Vikings. Let's look at some things from last week. Let's see, where did it go? Here it is. Here we are. Okay, so last week we did the case study activity. Julianne graded that, so I haven't had a chance to look at that very much. I did look at the cultural forum, and that was really interesting. Boy, we had all different kinds of cultures, from Hispanic, Kurdish, Somali. What else did we have? Karen, Hmong, Brazilian, Sudanese, all kinds of different cultures that have pockets around the country that are more prevalent than in other areas. So in our area, I would say the most prevalent is Hispanic. So actually this week I had a lovely patient who went home to Mexico for 3 weeks, and when she came back, she brought me a little handmade doll in like the traditional Mexican dress. It was just so thoughtful and so adorable. And just an aside, in one of my exam rooms, I have a map of Mexico, because so many of my patients are from Mexico, and just to get to know my patients a little better, I always ask, oh, like, where are you from in Mexico? And is it mountainous? Is it by the ocean? That kind of thing. And I never really knew where anything was. They could kind of tell me. So I put a map of Mexico up in the room so they could actually get up and show me, and then tell me a little bit about where they're from. And that's been super helpful to me. And I think it's been really well received from the patients too. It helps to make a little connection with them too. So another interesting thing about our forum last week was how many different cultures have the traditional, especially postpartum, warm or hot and cold kind of traditions. Like I know the Hmong kind of follow that, and I think or the Chinese as well. Just very interesting. And I also find it fascinating to think about why tradition started. So why is it so important that postpartum women just eat warm foods like oatmeal and chicken, or some other things I had written down, tea. What is the foundation of that? Like, what did people recognize as time went on that helped them to understand that those things were important? Well, if you sit back and look at it, well, like, those things were usually high in iron. So postpartum moms really need that. And the things they were eating were very low as far as things that would be contaminated. So they're not eating like pork, which years ago could be very contaminated, worms, things like that, and just wholesome food. So I don't have any scientific thing to back me up on that, but just when you step back and look at why a tradition has become a tradition in the first place, those are just some things I like to think about. But you guys did a really good job and provided a lot of insight into the communities in your or the different cultures in your communities. Another interesting fact was how many cultures don't initiate breastfeeding right away, but then end up breastfeeding. So just some things to consider when you're doing your patient teaching. So thank you for doing that. It was really nice to read about all those different cultures. And the SOAP note charting assignment was also due last week, and I will start getting busy grading those later today after the Vikings game. So coming up this week, we're doing the HEENT. There is a health history assessment example for you to look at this week. That should be very helpful. There's also an exam video that's just 17 minutes long. Reading chapters 14, 15, 16, and 17 in your Jarvis text will be extremely helpful this week. So Please read that. And some Jarvis student resources videos as well that correspond to those chapters. There are no midweek activities due this week, so no forms or anything. We really want you to take this week to focus on this adult health history paper so that you have time to do it really well. So let's look at that together. So you want to identify an adult non-family member, preferably female, who meets the following criteria. So number one, they have to have an acute health problem. So an earache, upper respiratory tract infection, COVID, abdominal pain, shortness of breath, something like that. And at least one chronic health problem. So that could be something like asthma, depression, eczema, anything like that. And they cannot be adopted because we need to complete a full health history. And if they don't have access to their family history, then that won't be, that you won't be able to do the genogram, which is part of this assignment. So you're going to complete the adult health history with your client and going through the history templates in your text on pages 45 to 54. Use that as your starting point for the format. We do not want you to copy the format exactly. We want to see that you're actually making this your own and applying it to your patient. Make sure that you assess for integrative, complementary, and alternative therapies, because a lot of our patients are using those as well. So make sure you do include that and ask about that during your interview. One big thing is confidentiality needs to be maintained throughout. So you can either label the patient as like Jane Doe or Mrs. Claus. I've seen that a few times, or just put like a first name and then X's for the last name. That would be appropriate too. Do not put their real birthday. Could make up completely a birthday that is obviously not correct, like 1823 or something like that. We just don't want to risk breaching confidentiality at all. Administer the assessments and interpretations in the body of the paper. Include interpretation and recommendations, including the nutritional assessment. The genogram is found on page 53 in your textbook, and you can do that just using the tools in your computer, your drawing tools. So you can create that as best as you can. And it really helps, like now, currently, like if you use an EPIC kind of system, when you go to family history, it can kind of create a genogram for you. So that helps you to identify trends in the family history that maybe aren't as apparent when you're just kind of writing it out. So as time goes on, that's getting easier and easier, but still important. Let's see, another thing is the family history should be listed by problem area, not family member. So here's an example: cardiac, mother has hypertension at age 60, father had MI at 62. So any cardiac problems you're going to list out here like this. You're not going to say mother and then all her health history. We want it to go by system like that. So if that makes sense. I mean, you don't have to make up categories like diabetes, none. You don't necessarily need to make up every potential health problem, but just list the ones that are present. You want to present several potential diagnoses based on the health history. Do not just give us one. I would say a minimum of 2, but more if appropriate. And at least one of those should be related to psychosocial or spiritual assessment. And a lot of people forget this and lose points on their paper because at least one of your diagnoses should be related to psychosocial or spiritual. So that could be things like situational anxiety related to recent move, increased stress due to being a grad student, something like that. Just make sure that you don't forget those psychosocial assessment / diagnoses. That needs to go in there. Another thing I'd like to point out is review systems, which is outlined in your textbook. That seems to stump people a lot. You're in a new role as a advanced practice nurse. And so review of systems is kind of confusing when you first do it. So it is listed under subjective. So that tells you this is what the patient is telling you. So anything under subjective is what the patient tells you. So, for example, you're not going to put any objective data in there. You're not going to say, oh, patient appears to have a fungal infection in the nail. These are just things the patient is telling you. So she could say things like, oh, I have constipation, but I'm treating that by using Miralax every other day, and that seems to work. Nothing objective that you are observing goes in there, and nothing of the family history goes in there. So under head, you're not going to say patient's mother has history of migraines. Just your patient and what they are disclosing. So in my clinic, what we do is I give them a form to fill out prior to their annual exams, and it has a review of systems written out by system. And then there's some potential things like shortness of breath, trouble sleeping, dental problems, headaches, things like that, that patients could circle. And then it triggers us to talk about it more during their physical. So that's how I want you to kind of address the review of systems. And if you have any questions, please let Julianne or I know, because this is a new way of thinking for you. And sometimes it just takes a little bit of practice. So that's what we'd like you to do on that. Go back here. Oops, went one too far. In addition to that, let's see, go to week 4. You are also going to include each of these things in your assessment, in your paper. So the Zung Depression Scale, some people use that. In my clinic, we use the PHQ-9. That's just how we work our clinic. There's the mini mental status exam and the mini cognitive screening exam for cognitive impairment. And I have those here. So let's see here. I already downloaded that, but I'll show you anyways. Here's the mini cognitive exam. So you don't necessarily need to include this form in your paper, but you do need to include their score. So let's see, here's the Folstein mini mental state exam. I would read through this too before you first give it to your patients, so you're kind of aware of what's coming, so you don't stumble and take time away from their assessments. And then the depression scale. This is one I tend to hand patients and let them fill out themselves instead of reading it to them. I think patients are a little bit more honest when they answer it themselves. So that's what's coming up for this week. I didn't have a specific devotion for you this week, but I did want to challenge you to practice some self-care. Now, don't sigh and roll your eyes at me when I say that, because us as nurses and practitioners give that advice every day that we're at work, that you need to take time for self-care. You need to take time for self-care. And we always think that, yeah, I'm fine. I'm fine. I'm good. Sounds great, but I don't have time to fit that into my schedule. But why is it so important? Why do we tell people that? And one thing is that we're called to be stewards. At its core, self-care, I wrote some stuff down, so that's what I'm looking at, so I don't forget to tell you all these good points. Self-care is all about being good stewards of our bodies, minds, and souls in order to become the best version of ourselves. In Genesis, God commands us to take care of all of his creation. And guess what? That includes us too. So we've been commanded to do that. And as nurses and moms and everything else, we're really good at doing that for other people. And we're really bad at doing it for ourselves. So this is your little reminder. We are his handiwork, and he wants us to flourish and thrive in beauty and love, not to be tossed aside or neglected, whatever the motivation. We can't give what we don't have. Remember that? We've all heard that we can't give what we don't have, and this remains true when it comes to taking care of ourselves. There are so many demands on our time, attention as women, family, work, children, friends, volunteer work, grad school, and we don't take the time to tend ourselves. Our well will dry up quickly, and we will have nothing left to give. So to be a good mom, a good wife, a good nurse, a good student, we have to take care of ourselves. Don't forget that. When it comes to things we care about, like our family, our work, school, none of us aim to give the very least leftover little bits of ourselves. Rather, we desire to give the very best of ourselves. So when we take care of ourselves, we are filled up, renewed, and restored so we can offer the Lord and the people around us the very best of who we are. When we begin being intentional about the wonderful creation that is us, the need for self-care becomes apparent. Taking care of ourselves is not selfish. It's the service of providing others only the best of who God created us to be. So remember that. When we take care of ourselves, we are filled up and renewed and restored to give to others. And additionally, scientifically, it's been proven that when we perform self-care, we're more productive, we have more energy, and it all goes hand in hand. You can get a little bit more work out of the time that you're given if you practice some self-care. So my goal for you for this week for self-care is to set aside 10 minutes every day to do something for self-care for you. So that's phones off, screens off, and do something for yourself. So I don't care if that's taking 10 minutes to enjoy making a cup of coffee and going out and sitting and enjoying the sunshine and soaking in all that vitamin D that we need. I don't care if it's walking around the block for 10 minutes, soaking in the tub for 10 minutes. It could be something different every day. I just want you to practice what we preach to our patients and take care of God's creation, which is you. So have a great week, and we'll see you next time.